Let's take you to this conversation now. Africa is facing a dangerous malaria resurgence with child deaths rising and a critical funding gap threatening to undo decades of progress. This is now according to South Africa's Goodbye Malaria, which recently committed 94 million rands towards frontline elimination efforts. Despite low local transmission, nearly 5 million South Africans remain at risk, particularly in KwaZulu-Natal, in Limpopo and Mpumalanga. Malaria threatens education, economic productivity and development ambitions across the region. Sherwin Charles is the CEO of Goodbye Malaria. Thank you so much for your time, Mr. Charles. So when we talk about a resurgence, one assumes at some point we are winning the fight against malaria. What are we doing right and what is it that still needs to be done?
Thank you very much for having me on this morning. Since the early 2000s, the fight against malaria has made incredible strides. Together as malaria around the world, particularly in sub-Saharan Africa, we were winning the war. You've seen the number of deaths more than half, particularly amongst children under the age of 5. And you've seen the number of cases reduce around the world by more than 50% as well. However, of recent, we've seen first a stagnation in progress, and now we're starting to see an uptick, particularly in the number of deaths amongst children, as I said, under the age of 5. The main driver of this has been we find ourselves in an economic period where low resources are available. Now, if you look at sub-Saharan Africa, most of the funding for the fight against malaria comes from donors, mainly the Global Fund, and previously what was known as the President's Malaria Initiative, which has been curtailed this year. That funding provided about 70% of the funds used in sub-Saharan Africa for malaria interventions. Unfortunately, we've seen aid budgets being drastically cut, and this is the reason you've seen the news of late.
And Sherwin, many people associate malaria with the tropical sort of, regions. And I think I'm one of those people that are guilty of that. Just how close to home is it at this stage as we have this conversation?
So malaria is prevalent in South Africa, but just along the eastern part of our country. So Limpopo, Mpumalanga, northern KZN, are the high-risk areas for malaria in South Africa. In Eswatini, it's very, very low. Eswatini is probably the closest of the countries in Southern Africa to eliminating malaria. However, our neighbor Mozambique is probably the third highest country in the world for the number of cases of malaria. And so most of what we see in South Africa is imported cases coming from our neighbor to the east. The work that Goodbye Malaria does covers 3 countries, Mozambique, Eswatini, and South Africa. And the idea is to deal with the malaria problem at source for both Eswatini and South Africa, which is southern Mozambique, provinces like Gaza and Inhambane, where malaria comes across the country. This time of year is particularly important because when we get to the holiday season, a lot of people visit Mozambique during the summer holidays and are not aware of the risks that malaria bears in those regions. So really to say to people during the holidays, if you're traveling to any endemic area, please take precautions. There's many ways to protect yourselves, and the prophylaxis is very safe.
And why does it seem like this is now a persisting problem, despite those global efforts we've seen on a grander scale to ensure that we cut down on those malaria infections?
So not only is the resources an issue, But more importantly, we've also seen a drastic change because of climate change. We've had increased temperatures, and that allows for mosquito populations to explode. We've seen high levels of rainfall, which leaves stagnant water, which once again promotes mosquito populations. But also, the floods have had devastating effects, prohibiting people access to healthcare, particularly in the rural areas, but also washing away during the flooding the malaria prevention interventions that take place. So, for example, the loss of bed nets or washing away of indoor residual spraying that has been done on the homes in those affected areas. So climate change has been a big part of what we see in the growing number of cases. Sadly, there's a third element that's also impacted us, which is resistance. So we've seen mosquitoes starting to build resistance to the current insecticides that are being used. We've started to see slight resistance to the medication that we use for fighting malaria in certain parts of sub-Saharan Africa, not in Southern Africa at the moment. So that's quite important. And we've seen a slight change in the disease where the diagnostics are now not as effective. There are many new tools that are in the pipeline that bear lots of promise. However, when you have low resources, you can't bring those new tools to bear.
And I want us to zoom in more into understanding the transmission science around malaria. I want us, we usually hear about, mosquito-borne transmission, but there are environmental as well as behavioral factors that also contribute to heightened exposure. Let's talk about those.
So what you're seeing is that mosquito behavior is how the interventions are built to protect people from malaria. But what we're seeing is that traditionally, malaria transmission has been seen indoors. Now what we're starting to see is transmission is happening outdoors as well. We've also seen that in high altitude areas, you wouldn't normally find mosquitoes there that transmit malaria. But however, with temperature rising, suddenly in the higher altitude, what used to be the colder areas, the areas have warmed up and mosquito transmission continues. What we've also seen is because of rainfall patterns changing, malaria is normally seasonal, and those seasons are starting to change. So we're seeing earlier transmission of malaria peak seasons happening for a longer period. So particularly, say, in Southern Africa, your malaria season tends to be from October, November to about March. What we're now seeing is that it's going from September to May. So this all starts adding risk to us succeeding in the fight against malaria.
And now treatment, prevention, as well as technology also becomes an important element in this conversation. Sherwin, how accessible are the newest, malaria treatments and testing kits to ordinary communities? I mean, their ability to also reach some of those communities in rural areas.
We've been very successful in increasing the access to the tools needed for malaria. However, what we're starting to see is that the new interventions are starting to cost a little bit more. One of the breakthrough successes we've had is the introduction of a malaria vaccine. And that has now been rolled out to more countries as it becomes more cost effective. But the challenge still remains is that we need to increase the funding pot. And with the Global Fund's replenishment taking place recently in Johannesburg, it was hosted by South Africa and the UK alongside the G20 last week. It was very important for new funding to be brought to the table. Whilst the Global Fund did not meet its ambition of raising 18 billion, we managed to raise just under 12 billion last week. That will allow us just to continue essential programming, but it doesn't allow us the opportunity to bring these new innovations and tools to bear at scale.
And so much has also been said about some of the gaps that we're seeing, particularly in the public health system when it comes to malaria response efforts. What's the sense that you're getting right now? Do we have healthcare workers that are well equipped to be dealing with malaria?
The tools are simple and they're easy, and the medication is extremely effective. We've got to make sure that we don't have stockouts. We've got to make sure that logistic systems work, and we got to make sure that it stays on the radar. In some of the areas in South Africa, malaria is not the biggest public health issue that they have to deal with. And so sometimes access to the most needed medication and diagnostics is not available. So with Goodbye Malaria, we have mobile clinics all along the eastern part of the country, and those clinics are readily available to test and treat people. We tend to deploy them along the borders where we know that malaria transmission is higher, and those clinics are most definitely all the time have the medication and the diagnostics at hand.
And I'll tell you what that speaks to. That speaks to us needing more hands on deck to ensure we win the fight against malaria. I know you also talk about your decade-long support of Mosaswa interventions. What are these?
So I think what we look to do is create protection for people. So we do indoor residual spraying in southern Mozambique. As I said, in South Africa and Eswatini, we have mobile clinics that test and treat people. But what we've also started to do is do a lot more surveillance. So people in southern Mozambique who come through and test positive, within 48 hours, we visit their homes and we test the rest of their family as well as neighbors, and we treat them. So what we're trying to do is stop the secondary transmission of malaria. What you've seen in the Mosaswa region, which covers the 3 countries, is that we've reduced malaria more than 60% since we've been involved with the countries and the malaria programs. The success has been incredible, but as we said, we're now at risk given climate change, resistance, and much less cash.
All right, I must thank you so much for your time and insights right here on the program. And that is the CEO and founder of Goodbye Malaria, Sherwin Charles, there joining us on that conversation. Thanks so much.